Hello. Going to give folks a couple minutes to stream on in, but welcome everyone. Happy New Year. Hey everyone, we'll get started in just a minute or two. There's a lot of people streaming in the Zoom room right now. So just be a little patient with us, which I think is a good tagline for what's coming over these next few weeks. Be a little patient with us. Nice to see everyone here. I hope everyone had a happy holiday. Got to spend some time with family and friends. Okay, I'm going to give it one more minute and then we're going to get started. Thank you so much to all of you for joining us. And if anyone's watching right now, streaming on YouTube, hi to you as well. Okay, people still coming in. Got over 200 folks on the call right now, or on the Zoom right now. Just give it another few seconds. Okay, I am going to go ahead and get started. Good evening, depending on where you are. It's actually afternoon where I am. I am not in my office or at home. I'm actually had a previously planned trip to come see my 82-year-old dad here in Arizona. So I'm actually sitting in his house and do a little business, family-oriented business while I'm here in Arizona. So, but this is really important stuff. And so I'm happy to take the time to talk with all of you. And we've got great experts with us today to be sharing a lot of information about what's happening right now, where we're headed over the coming weeks, and hopefully start to get a glimpse of the longer term as well. So many of you have been on webinars with us before, but we're going to try and keep this to an hour. And we're going to speak for the first bit of it and then answer questions. The way you ask a question is in the Q&A box. You can type questions in there, and we actually have people who will try to be answering those all the way along. And then some of them, especially the more general ones that we might be getting a lot of, will answer also on the video. And this whole thing will be posted on YouTube as soon as it's done, and is streaming there live right now. So hi, YouTube people. Okay, next slide. With great thanks to Kate, the fabulous Kate Beveridge, who makes everything work, and Jolene as well. Thank you to both of you. So Happy New Year. Welcome to 2022. I am not sorry to see 2021 go, but obviously 2022 is starting on a bit of a challenging footing as well with the Omicron variant. And what we want to do today is to really share as much information as we can, answer as many questions as we can, and just have you hear from us about all the thinking that we've been doing on campus. Our CERT, Coronavirus Emergency Response Team, met throughout the break and worked quite hard last week when they were all supposed to be on vacation to make some decisions based on and build web pages and communications that you've been seeing over the past few days. And so great gratitude to them. So again, we're going to walk through a lot of that info, a little bit of emerging new info, and try and answer lots of questions. Next slide. I want to start as I always do. I start every town hall. We do a lot of discussions with employees and community members. And this is really, this slide hasn't changed in 2 years now. Our North Star is about keeping our community safe and healthy while helping our students advance their educational goals and supporting our faculty and staff in doing that. Keeping our family together. We know how important it is that we are together. One of the things I really want to emphasize today is this treating one another with great care and respect. This is an incredibly stressful experience for our health team dealing with the surge. And we know it's a stressful experience for families, for students, for faculty, for staff, for folks with kids in school at home, for, almost everybody's got high levels of stress around what's happening right now. And we're all, I know you would expect this, but the level of commitment, care and work that's happening on this campus to try to move us all forward together is extraordinary. And I would just ask that you remember always that there's a human being on the other side of an email or a phone call or a phone message, and that we continue to work to treat each other with the utmost care and respect. So these North Star elements of our strategy have not changed. Next. So what we want to do today is say welcome back. We're happy to be heading into C&D term and spring semester, provide you an update on where we are with COVID on our campus, and then review the reentry plans. And a lot of what we'll talk about today was in the email that came to you on Monday. And a few things have been a little bit tweaked since then, not a lot. And again, just to be able to provide you a little bit more fulsome explanation and perspective on why we're doing what we're doing. Next, and of course, people have different learning styles. So some people like to read it and some people like to hear it in a video. So that's why we're doing this too. So I'm going to share the stage today with three of our leaders who are deeply involved in CERT every single day, more than any of them could have ever imagined. Lisa Pearlman, who's our fabulous Director of Health Services, John McNeil, the Dean of Engineering, who is really the senior academic rep on CERT, and Philip Clay, who's been co-chairing CERT from the very beginning, our Senior Vice President for Student Affairs. So I'm going to start, but then I'm going to hand off to, and each of them will chime in, and I'll come back at the end and then we'll answer questions. Next. So first of all, welcome back. As we were wrapping up the fall terms, there was a lot of activity on this campus, from research labs to athletic competitions to great gatherings around the beautiful sort of fire pit things on campus, and lots of wonderful student activities. And it's really our goal to make sure that all of those things can continue to happen on our campus. And what you will not hear today is that we are having a bunch of restrictions on in-person gatherings on our campus. We are thinking hard and making sure that we're doing those things safely, but we recognize the importance of gathering together, of community, of coming, as our wonderful Dean of Arts and Sciences, Jean King, says, coming together in unity. That is what we have done. It's what we need to continue to do as we come back in January, but we need to do that safely. And so we've got some things we're putting into place to help us be sure that we can preserve these opportunities for community. Next slide. So let's talk about like the foundation of the COVID update here. So first of all, it's very important to remember that this campus is a very safe community. 97% of faculty, staff, and students who are on campus are vaccinated. That is extraordinary. And we'll talk later about the booster requirement, and we're going to tell you about a couple of booster clinics that we're hosting on campus. If you haven't yet gotten your booster, get it as soon as possible, or come to one of these clinics, sign up for that. But we're a very safe community from the perspective of everybody being vaccinated and boosted. We are continuing to follow the science. Like me, I'm sure you all are, reading the newspaper, watching the television, and watching video of, the CDC director as she's talking about different isolation requirements as we're learning about Omicron, which is, happening in real time. The science does change and evolve. And that's one reason our approach has to continue to change and evolve. I know that's frustrating. I know that causes anxiety, causes stress, but it's what it means to follow the science. This is a technological institution. People understand that knowledge changes and evolves over time, and our approach to COVID has to change and evolve as that knowledge does. So we know the Omicron variant is here. It's raging in Massachusetts. It's prevalent across the US, but Massachusetts is really, we hope, approaching the peak in the next week or two, and is having higher case numbers than ever during the pandemic. What we know about this variant is that it is much more easily transmitted, as lots of us who know people who are infected even right now can attest to, but that it's also usually not very serious, especially for vaccinated people. So that's, the bad news and the good news together, right? And so here's the thing, and this is, I think, one of the things I'm really hoping, and I think I literally said, let me say this again in the message that I sent to you. we're going to have a lot more positive cases on this campus. We were typically in our surveillance testing seeing positivity rates of a few tenths of a percent, a handful of cases in a day. That is clearly not where we're going to find ourselves over this next few weeks. I wouldn't be surprised to see more than 100 positive cases in a day next week when people are coming back. I wouldn't be surprised at all for that. And so we're just going to have to be ready to see those numbers much, much higher. But the vast majority of those folks who get COVID are going to have very mild symptoms like allergies or, a cold, or many more of them than in the case of Delta have actually been asymptomatic. So much less severe symptoms, much more in the head and not in the chest. And so that again is the good news. But this larger number of cases, much, much larger than we've seen before, which we know is going to happen, and we'll show you some early data in a second, and the updated CDC guidelines on things like isolation and quarantine are causing some changes to our protocols. And so we just want to be really transparent with you about what those changes are, how it's going to be different, and make sure that everybody walks in eyes open, and where are the resources where you can get your questions answered here and elsewhere. So that's really what this is about. So we're walking in eyes open. We want all of you to do that as well. So I think the next slide is the results, and I want to hand over to Lisa Pearlman, our Director of Health Services.
Hey everyone, it's great to see so many of you all here today. And as you can see, this is just a snapshot of our COVID dashboard, which you can all access whenever you want. And you can see that we're starting to have an uptick in cases really this past week as we've started testing again. And that's just mirroring what's happening nationwide right now. So, we kind of need to expect this, as President Leshin was just talking about. We in the health team expect that we will see our highest cases to date of COVID-19 in the next few weeks. So that's the bad news, but kind of the good news is just that, most, if not all of these cases will be the Omicron variant, which is just a milder variant for most people, particularly people who've been vaccinated and boosted. And so, for most people, this will be more like a mild cold that can be managed with just over-the-counter medications. We're seeing many fewer hospitalizations with Omicron. So, we're feeling like even though we'll have many more cases, that these can be managed, pretty well just by isolating and taking good care of yourself. So we're going to forge right ahead, but we don't want anybody to be shocked by much higher cases than we've seen in the past. So let's go to the next slide. So there are some things that we wanted just to prepare you for before you return to campus. And we've been thinking carefully about how to get you back safely. So the first thing is, if you test positive over the break, we really need to know about it. And the way to inform us is to use that symptom tracker app and just, press the button saying, I have tested positive. So one of the things that's changed is that we're not going to be able to pick up the phone and really call everybody who presses stuff on the symptom tracker anymore, which is what we used to do. But we really have worked hard to get some automated responses. And so you will get a response to the symptom tracker, which will direct you to all the information you should need about isolation and symptom management and kind of what to do about close contacts. So just really, if you did test positive, please let us know. And just also know that if you tested positive for COVID, you'll be removed from our surveillance testing program for 90 days, because lots of people will continue to test positive on PCR tests for a long period of time. And often that encompasses some time where they're not actually infectious anymore. So it's just best to get you out of the testing program so that we don't have just repeat positives from you. We're really asking students to try their very best just to get tested before arriving on campus. Just any test that you have that you can get your hands on would be great, but we'd like you not to come to campus if you test positive. So please try to get that pre-arrival testing done. And then As soon as you do come to campus, we're going to have you just get your first PCR test from Harrington. And we are asking that students not participate in any in-person activities until they've actually gotten 2 negative PCR test results on days that are not consecutive. So you'd get tested on a Tuesday and maybe again on a Thursday or a Friday, but we need you to have 2 negative PCR test results before you're engaging in in-person activities. We're also asking employees to try to get a negative PCR test result before they're actively working on campus if they can. And then lastly, if you find out in the day or two before you're coming to campus that you tested positive, please don't come to campus. Or if you get sick the day you're supposed to come back, don't come. Just instead fill out your symptom tracker and we will get in touch with you. Certainly if you tested positive within the 5 days prior to coming to campus, you should be isolating and not coming to campus. So just fill out your symptom tracker and we will outreach and make sure that we give you the right information. Let's go on to the next slide. So we've tried to anticipate some of the frequently asked questions. There's so many questions about testing, we know, and these tend to be most of the questions we get. So we wanted to try to do a few of them in this group setting in the hopes of answering them for lots of people. So the first test, I can't find an at-home test. Like, what should I do? And our answer is just keep trying. You know, we hear that a lot of like CVS's or Walgreens get their shipment in at 8 a.m. So try in the morning maybe and see if you can get an at-home test. But it would be really great to keep trying. And then the other thing we wanted to do was to open up some testing options on Saturday at Harrington and Sunday as well. So we have Harrington open during specific times for testing. You could, if you live close to campus, just drive to campus, grab that, you know, quickly do a test in Harrington, and that would be really helpful. But we're just asking you to do your best. The next question, can you go home between 2 PCR tests? So really, once you're back on campus, we're really trying to kind of rebuild that bubble as best as we can. So we don't honestly want you going home unless you're a commuter student and you actually live at home. So once you come to campus, we're asking that you get that first test and then just kind of lay low in your room until you get that second negative PCR test. So we're really hoping that you will avoid leaving campus a lot before you get 2 negative PCR tests. The third question, I'm scheduled to have my first PCR test and move in on January 11th. Can I attend class on January 12th or 13th? And so again, we are asking people to have 2 negative results before they actually do any in-person activities. So you're going to kind of spend the first few days laying low and getting grab and go meals. But once you do have those 2 negative PCR tests, you can just do normal activities on campus all in person. Can I stay home for the first 2 weeks of the term? Yes, you can definitely stay home for the first 2 weeks of the term if that's what you choose to do. Just know that when you do come, you will still need to onboard the same way that you would have had you come 2 weeks earlier. So we're still asking you to get that pre-arrival test and then to lay low until you have 2 negative PCR tests. I tested positive for COVID last fall. Do I need to take the re-entry test? So if you are still within that 90-day test exemption, you don't need to take any tests, either a pre-arrival or an onboard test, and you just can come to campus. So, but you need to be within that 90-day test exemption period from when you last had your positive test. The only time that we would want to talk to you about that is if you become symptomatic. So if you are within your 90 days and you actually start feeling sick, you really need to fill that out on the symptom tracker or get in touch with health services, because at that point we might decide to test you with a rapid test. And last, I took a PCR test in Harrington on Wednesday. Where are my results? Why aren't they back yet? And we put this question in just because we actually just got a communication from the Broad Institute, who processes all of our PCR tests. And they're just seeing a huge influx in the number of tests that they're getting right now. And they've just let us know, hey, our turnaround times are slowing down for the next few weeks. they're trying desperately to keep up. So, we're just going to need to be patient. So it's not that something went wrong. We're just, the test results will eventually come. If for some reason you actually are sick, then we want you to get a rapid test at our rapid testing trailer, and those results will come back in 15 minutes. So there is a way to get a quicker result if you're actually symptomatic. So let's go to the next slide. All right, so what's changing? So what we've decided is that we really want to try to catch positive cases as quickly as we can. So for the month of January, everybody in our community is going to test twice a week. It should be fast and easy still at Harrington. We're prepared for more people coming through. And so you can make your appointments the same way, and everybody's getting tested twice a week. Another thing that this is a huge change, so I really just want to make sure everybody's very aware. We just are not going to have the people power to call every positive case anymore. And so it used to be that if you had a positive test result, you would not get an email. You would get a phone call from the health team, but that's all changing. At this point, it will be an automated email that you receive for all test results. So you really need to open up those emails and see what it says, and then log into that tough system to see your test result. So all test result notification, and that includes positive tests, will be through email for right now. So please open up those emails and read whatever they say. You'll also be getting a lot of information about what to do if you test positive through email. So we've worked really hard to make sure that we've written down all the things you should need to know. Another thing that's really different is how we're going to notify close contacts that they've been exposed. We're really going to honestly ask for your help. Like, we just don't have, again, the people power to do all the phone calls that we used to do. So if you find out you test positive, we're really asking you to text or in some way notify your close contacts. And just to review, close contact is anyone you've been around for 15 minutes and an accumulated 15 minutes within 2 days of testing positive, before you test positive, or the day you test positive. So we're just really needing you to notify your own close contacts, and then we'll have instructions for you that you can email to your close contacts so they know what to do. And in general, we're following all the CDC's latest guidance. So close contacts will just need to follow the CDC's guidance on that. And we've actually created this new webpage, which is live right now. It's called What to Do If You Test Positive or You're a Close Contact. And it has all the answers right there. So we're going to have QR codes around, and you should easily be able to access this webpage, which just has most of the answers on it. So what do you do if you test positive? So basically, employees should go right home, and students will typically isolate in place or at home. You can kind of choose what you're going to do, and we're going to talk about that a little bit later. And then you're just going to follow the guidance on this new handy dandy webpage called What to Do If You Test Positive or You're a Close Contact. And that will really give you lots of good information. We're also going to ask that everybody just do grab and go dining for the first week that you're back, and seating dining will return on January 16th. But again, we're just trying to kind of rebuild that bubble before everybody is out and about a lot on campus. How about the next slide? So I want to talk a little bit about isolation, because that has really changed. We're just anticipating that we don't really have enough isolation space to move all residential students into the townhouses, which has been our isolation space in the past. So we're really going to have to kind of prioritize those spaces for people who really need it. And what we came up with is that, really that space is going to be used for people who have roommates who are either immunocompromised or have other health conditions that would put them at higher risk. So it's really important that they are not in the same room. We also will prioritize it for students living in triples, and for students living in kind of quarter style halls with large bathrooms that they would be sharing, but we do anticipate that we might run out of this space. So we're going to really try to utilize it as best as we can. But there is definitely the possibility that you will be isolating in place with a roommate that you're sharing a bedroom with who has not tested positive. And so that is just something to know. Obviously, everyone has the opportunity to go home to isolate if that's a safe thing for them to do, and they can drive at home. And we will kind of be in touch with you about that. If you have questions or whatever, you can always reach out to the health team about what's the best choice. And we actually we're making this new form that all positive cases will complete. It's this automated form, and we'll ask you all kinds of questions to help us figure out who should not be isolating in their room and what health conditions you might have, and lots of other questions. So we've been thinking about how to really carefully gather this information and help you to make the best decisions possible. We have done all this work to come up with different places that we will have meals delivered every day. And so the idea is that isolated students will be able to wear a mask and go grab the day's meal. So that's 3 meals once a day from designated locations, and we'll have that all outlined for you. And then I guess the super exciting news is that isolation has been reduced to 5 days per the CDC. There's lots of, nuance about this. And so just to really be clear about it, we're going to follow this guidance really as it's written. So students and employees will be released from isolation on day 6 if they are asymptomatic or their symptoms are improving. They have to be fever-free for 24 hours without taking, a fever-reducing medication like Tylenol. And lastly, they have to have a negative antigen test, which we are going to be providing, and there'll be lots of information about that, as well as completing an automated clearance form. So now there's going to be an automated, I tested positive for COVID form, and another one that's I'm now clearing isolation form. And then lastly, it's important that people continue to wear a well-fitting surgical or KN95 mask for an additional 5 days after they are released from isolation, if they release on day 6. But basically, people need to be wearing a really good mask for a solid 10 days once they are positive. Let's go on to the next slide. All right. Close contacts are also changing a bit. So again, we're just following the CDC guidelines, and this has changed very recently. So since during this break. And so what happens if you're a close contact? First of all, we're going to have lots of information on that page about what to do, but you're going to need to wear. So for people who are actually vaccinated and boosted, or vaccinated and not yet eligible for a booster, you're going to wear a great mask for 10 days. You're going to get tested on day 5 after exposure. And honestly, if you're just in your normal cadence, that should pretty much happen. But you can go to class and activities, and you just need to really monitor yourself for symptoms. And if you develop symptoms, we're going to ask that you not go to class until you have tested negative. And we have this rapid testing trailer set up in the Hackfeld lot to help test people who are symptomatic. If somebody is unvaccinated or you are eligible for your booster shot and you have not gotten it, you're actually going to need to quarantine at home for 5 days now, and then follow all those things that I just talked about. So that's a big change. But yeah, and again, we're just following the CDC guidelines around this. And lastly, what happens if your roommate tests positive? And really, we're talking about somebody that you're sharing a bedroom with. We're going to really, we know that there's a good chance that if you're sharing a bedroom with somebody that it's likely that both of you or all 3 of you would be positive. So we want to try to catch you quickly. So if your direct roommate is test positive, we're going to ask that you actually start testing every day at Harrington, and that you really monitor yourself for symptoms. And if you start to feel sick, you come to the rapid testing trailer, and that you wear a really good mask. So let's move on to the next slide. We've also kind of changed our policies a bit about masks. There's just more information out there that cloth masks aren't as protective as a well-fitting surgical or KN95 or one of those KF94 masks. So the CDC is really recommending that people wear better masks, and we're going along with that. So if you are going to wear a cloth mask, we're asking that it really needs to be double mask with one of the above. So you can wear a surgical mask and then put a cloth mask over it just to make it kind of tighter on your face. But for at least until things really change, we're asking that everybody wears a really high quality, well-fitting mask. We're going to actually provide a bunch of KN95 masks for people if you need them through Harrington, through some other spots on campus. So we will have surgical and KN95 masks for you to pick up if you need it. It'd be great if you could just bring a supply with you to campus, but we're really asking everyone to wear a very good mask as they come back. Let's go one more slide. And this is basically just a picture of what the different kinds of masks look like. So yeah, get great masks. It's super, super helpful in preventing the spread of Omicron. We've been reading all about how important masks are for this. And I think this is my last slide. And so I'm going to let Dean McNeil talk a bit about changes to academics, but thanks so much for listening.
Thanks. Thanks very much, Lisa. Yeah, so again, my name is John McNeil. I'm Dean of the School of Engineering and the representative for academics to the Coronavirus Emergency Response Team. As you've seen, and I've seen from the questions in the chat, there's a lot of questions about what academics will look like. A year ago, we were going into a situation where we didn't have a vaccine. We had a lot of hybrid courses. We knew there were many students who wouldn't be able to get to campus at all. We're in a much better place this term, but as we saw at the start of a term, there are going to be a number of students who won't be able to get to class. However, we don't want to go fully remote for everybody because there are still many students who can attend in person and do want the in-person hands-on experience that's really a hallmark of WPI academics. So really what we're trying to do is prioritize flexibility both for faculty and for students. So we have given faculty the option to move to a remote delivery method for the first 2 weeks of class. Many of our faculty have young children at home, are caring for elderly parents, people who are immunocompromised, and there's uncertainty among the faculty as well. So some faculty may choose to deliver the first 2 weeks of their classes remotely. We've also seen that many students may want to stay remote for the first 2 weeks as well. So we've instructed faculty, if they are in person, to make sure they can provide content and some experience for the students who need to be remote. And as we saw in A and B terms, for students who are remote or for students who are in person but do need to go into isolation for a period of time, faculty will provide assistance for them through means such as lecture capture, where the lectures are recorded, or faculty will put content online. The faculty should hopefully have already updated their course syllabus and their Canvas site with instructions specific to their courses. If you still have questions and you don't see updated material on the Canvas site or in your faculty syllabus, reach out to those faculty and they will be able to provide you what's going on for the first 2 weeks. Throughout the term, faculty will be providing options for students who can't attend in person because they need to isolate or for whatever reason. And again, in most cases, we saw 90% of our courses adopt lecture capture in the fall, and it's not as good as attending in person. So some people have asked, can you just be remote for the entire term? I would not recommend that because we're going to try to get back to in-person instruction as soon as it's safe to do so. Again, faculty will be able to assist students who can't get to class for a short period of time, but we're going to try to get back to in-person instruction as soon as it's safe. And for many courses, for example, courses that have an in-person lab component, it was, as we saw last year, it's really difficult to do a high quality lab experience for remote students. And we can do it for the first couple of weeks. And we'll evaluate in the second week and see if we need to extend this remote period longer. But really our goal is to get back in person as soon as we can. During A and B term, or in B term at least, we were also able to use what we call the performer exemption in Worcester County so that anyone lecturing at the front of class or presenting in case of students presenting project work. If that speaker was more than 6 feet from the nearest person and everyone else was masked, then the lecturer could take their mask off. But we're going to be suspending that for a while until we know we've got things under control. For people doing project center travel, the global experience team is monitoring the situation in the various project sites that students would be traveling to, and there the recommendations will be specific to the individual project sites. So for project center travel, your IQP advisor, the center director, would be in communication with you about what's happening there. And I've also seen some questions about MQPs that need to be done remotely for the first 2 weeks. Again, work with your MQP advisor. Certainly at this stage of an MQP, there should be a lot of writing going on. There are certainly things you can do for 2 weeks to make progress on an MQP, even if you're not able to get to an in-person experience. And again, that's another reason we're going to try to get back to in-person as soon as possible. So I'll be available to answer more questions, and some of the questions have been answered in the chat already. But that's the situation for academics. Again, the keyword flexibility. Faculty know that students want an in-person experience, but some people just will need to isolate or may not be here for the first 2 weeks. So we will assist students in those circumstances. That is my slide, and I believe Philip Clay is next.
You are correct, John. Thank you so much. We could have the next slide, please. It's actually a perfect transition slide for the move from John McNeil to myself. This is taken in our innovation studio at the end of, right at the end of the term. And you can see that this is really our goal, is to get students cleared from their 2 PCR tests as quickly as possible and really focus on our reentry. Next slide, please. So for this reentry and reconnecting with campus life, again, we've seen over the past 2 years a great variety in different ways that we've approached each semester. And unfortunately, as the virus continues to have a vote in this process, we continue to evolve our plans accordingly. One of the most interesting things about this moment and what we've really tried to do over the last 2 years is trying to balance physical health and the focus on the impact of the virus with mental health and well-being, which we know has been a big focus of the last of this academic year. So we're going to continue to try to maintain that balance, and that's why some of the things that we've talked about, trying to get students back and engaging as quickly as possible, why we have not gone to a hybrid mode, all those things are really to try to support this sense of as normal experience as we can, getting students back into the swing of things and really able to connect with their academics. You've already heard about a lot of the ways that we're doing that in terms of reentry from Lisa and her presentation. But one of the ways that we're doing some of the things that we're doing to reconnect students with campus life, Student Activities Department and many offices on campus are planning a series of programs for the spring semester with particular emphasis on programs and activities on Tuesday, Friday, and Saturday evenings. That's something we heard a lot from students in the fall about, really feeling like we needed more activities and events for students on those nights. At the same time, because we know that some of our students will be remote, and frankly, some students may not feel comfortable connecting in-person activities, we'll also be planning in parallel a lot of remote opportunities for students to be able to connect. We're working on off-campus day trips around the area, snow tubing, the Museum of Science, things that will, again, allow students to connect with each other, which, again, is something that we heard from students that they were really feeling disconnected, and that was impacting their mental health. So this is all part of our plan to both address the virus, but also to continue to allow students to be able to create these connections with each other. The other thing that we've been actively planning on most recently is recognizing that there may, with a higher case positivity load, there will be more students in isolation at various points throughout the term. And so we're really working on creating virtual connection opportunities. Lisa talked about one of them earlier, that we may be looking at doing some town hall meetings or gatherings with students who are in isolation. If they want to have specific medical questions, that we can deal with those all at once. But as well as also creating potentially some social opportunities for students who are in isolation to be able to connect, not just in the classroom, but also with each other, with other students who are in the same kind of situation. So those are some of the things that we're actively working on. Next slide, please. And to bookend my remarks, I showed you an academic activity in the Innovation Studio, and this is one of the programs we had, a giant gingerbread contest that we had down the Goat's Head right in the week before we ended the semester. So these are the kinds of things that we know our students are craving, the kind of things that we want to provide for them, opportunities to connect with each other outside of the classroom. And with that, I'm going to turn it back over to President Leshin, who will finish up, and then we'll move on to the questions and answers. Laurie?
Thank you, Philip. Yeah, it looks like they got one of those gingerbread houses on a shake table there or something. They're going to test it for launch into space, I think, which of course, knowing our students, I'm sure it would survive the launch and, become the Webb Space Telescope or something once it was out there. Those are so fantastic. I love the creativity of our students. Next slide. Just want a couple more items before we stop talking to you and start answering questions. And I know we've been doing a lot of that already in the Q&A. If you have questions, please type them there. Just a quick reminder about boosters. Boosters are really, really important as we deal with Omicron, as we know that it can help prevent it does have some level of assistance in preventing infection, but most importantly, it prevents serious illness. So, that's our goal here. The fact that we have a highly boosted community is one of the reasons we feel really confident bringing folks back together. So the deadline is January 18th. And, or if you got your second shot, if you're not yet eligible, and there's some tweaks just today, actually, from the CDC, where they said if you got Pfizer, you can actually get a booster after 5 months. So 5 months if you had Pfizer, 2 months if you had J&J, 6 months if you had Moderna, because, we can all keep these numbers in our head. Get that booster as soon as you're eligible. And then you all are familiar with uploading your vaccination info into Medicat, and that's what needs to happen here by January 18th. The good news is we've got a couple of booster clinics on campus if you weren't able to get one while you were at home. So please register by Tuesday, January 11th. And we just posted in the chat a link to sign up for the booster clinic. So they're Thursday and Friday, and you can pick your flavor of booster and sign up there. So definitely, if you haven't got one yet, get one on campus. I got mine, mild, not, no issue. So please do that. Next. Okay, so we're only gonna, this is a hard moment. We're in a good position to weather it, but we've got to come together to keep supporting each other and get through it. So here's how you can help us keep WPI going, keep our great education happening in the way that we all want it to be happening. Get that negative test before you come to campus if you possibly can. Really, really try hard to get something negative before you're traveling here. And be sure you limit your activity until you have those 2 negative PCR tests. I did see questions about that in the Q&A. And listen, frankly, as people are traveling, this thing takes a few days to ramp up. So that's why 2 tests we feel like are really important. Masking, again, we can hand you a KN95 when you come to Harrington for your first test if you don't have one. If you do, if you've got surgical masks, good masks, bring those, please, and be smart about distancing. Definitely get that booster. Dining is a tough one. You take that mask off, of course, to eat. So just be smart. We're asking everybody to take a lot of personal responsibility here and be smart in these couple of weeks when we know cases are going to be high. If you have symptoms, if you test positive, use that symptom tracker to let us know, and familiarize yourself right now with the posted resources. We've got great information on the We Are WPI website, concise, organized well, clear. Go there right now and start to review that info so that you understand, if you test positive, and a lot of us will, I hate to say it, but a lot of us will, whenever we come back together on this campus, there will be a lot of positive cases. That's another reason why we aren't just going fully remote. because I think whenever we all come back together, given how transmissible Omicron is, we're going to see an increase in cases. So everybody should familiarize themselves with those resources. And lastly, don't go to class. Don't go to in-person events if you're ill. That's the best way that you can help us and help your fellow classmates and help one another. So I know that we tend to have a culture that's like, suck it up, we can do anything. We're going to class, even though, crap. That's what we need from you now. What we need is for people to really pay attention to their own symptoms and act accordingly and to protect yourself and to protect others as well. Next. So it's winter, and I guess we're gonna get some, I'm in Arizona. For those who joined late, I'm actually visiting my dad right now, but I'll be back in a couple of days. So I think I'm gonna miss the snow that's coming overnight. But, so it is in many ways, physically, it is the darkest time of year. And, but listen, this community has come through so much together, and I know that we can do this. I'm really, really confident in what we're putting into place, and we're going to continue to work together. If things change and evolve, we will communicate with you right away. We're going around the clock here on trying to make all of this work, and we're doing that for you, with you, because of you. You're the reason we're here. You're the reason WPI exists, you families, you students. And so just know that, we're here for you. We're going to do this together, as we have over these last 2 years. And I think once we get on the other side of this wave, things are going to be better. I really am hopeful about that. So thank you all for listening to lots and lots of information. We've got lots of questions. I want to turn things over to Director of Student Activities, Christine Sherry, who's going to moderate our Q&A and bring in some other folks to help us answer questions.
Thank you. Good evening. We've had a lot of great questions in the chat over the last half hour, and obviously a lot having to do with health related, specifically COVID. So these questions probably will pertain to Lisa and Chloe, but I think one thing that we've seen over is if a student becomes positive, at home prior to coming to campus, what should they do, or when can they return to campus, I guess? So if Lisa or Chloe are on.
Yeah, Chloe Green's our testing coordinator, and Lisa Pearlman. Can we get one of them or both of them on?
Yeah, I can answer that. So it's kind of about when you tested positive. So if you tested positive within the 5 days before coming to campus, you should not come to campus until at least day 6. And then, so you kind of have a choice. You can come on day 6 and test at our rapid testing trailer. And if you're negative, you can just wear your mask and continue on. But if the other option would be just to decide to stay home and isolate for the full 10 days, and then you can come to campus after 10 days and you don't need to be testing at all. So on day 11, you could just come to campus. But if you tested positive more than 10 days ago, you just really need to let the health team know via the symptom tracker. So it's pretty easy just to say, I've tested positive, and you'll be getting all this information and much more if you do that on the symptom tracker. So if you have questions about testing positive, just fill out your symptom tracker, and you'll definitely be able to get the answers that you need.
But anybody who tested positive over the break should not follow our 2 PCR test thing, right, Lisa? Because they are going to test positive again, because the PCR is super sensitive. And so that's why we pull people out of the testing program for 90 days, because you get some immunity when you have the disease, and then so you don't need to be tested because you're unlikely to get reinfected. So that's the one exception to that 2 PCR test thing, right? Is if you tested positive over the break, let us know, but then you're taken out of the testing program. You don't have to do your 2 PCR tests in order to interact and go to class.
Yeah, absolutely. The only exception, and this is really getting into the weeds, but for people who just did a at-home test and there is no test result to upload onto the Medicat student health portal, we're asking that you actually do a PCR test just so we can confirm that, so we know to take you out of our testing program, but you wouldn't isolate again. But again, this is a very, granular question that will really only affect a few people. And you can be in touch with the health team about these very specific questions.
Lisa, don't go anywhere. So if someone did recently test positive or contracted COVID, how does obtaining a booster impact them? Like, when would be a good time for them to think about getting a booster?
Yeah, so, I can give you just the CDC line about that. And the CDC says that you are eligible to get a booster, after you have completed your 10-day isolation. They haven't actually changed that to 5-day that I'm aware of in terms of getting your booster. But if you have concerns, I would really recommend that you reach out to your primary care provider and just talk to them about what's the best plan for when I should get my booster. So, I guess those are your two options. Just follow the CDC guidance and get it as soon as you've completed isolation. If you have specific health concerns that you want to discuss with your healthcare provider, do so. And that person can obviously write a medical letter for you if there are specific, if there's a specific concerns related to your particular health issues. So those are kind of, I guess that's my best answer for a harder question.
But really, for most people, you don't have to wait very long. Wait till 10 days is up and get a booster.
Exactly. That's the answer for most people.
Thanks. And Lisa, I don't know if you would want to answer this or if you would want to ask Chloe to pop on, but there were a couple of questions about the timing between the 2 PCR tests that we're asking folks to take on campus and kind of the reasoning behind the 2 test process for onboarding. Would you or Chloe be willing to talk a little bit about that?
Talk a little bit about it, and Chloe, feel free to jump in if you have, but I think President Leshin kind of just said the really good information already. Testing positive is a point in time. And so, and we just want the best chance of catching a positive test. And so you're not going to test the minute you're exposed. It can take a few days. And so if you were exposed during travel, then even if you come to campus on Monday, that test isn't going to be positive because there just hasn't been enough time yet for that to happen. And so that is why we're asking people to get two negative tests, just because we really want to catch as much of the positives before, because we know that Omicron is so transmissible that we really just want to try to limit that transmission on campus. And so we're asking everyone, and I guess the other part to that question is that we are asking people not to take PCR tests on back-to-back days. So you wouldn't test on Monday and Tuesday. We'd ask you test on Monday and Wednesday, just because, again, we really want to try to catch those positive results, and we just need a little bit of time. But if we can just be kind of patient and flexible, that first week will fly by, honestly. And I do think it won't feel like that huge an inconvenience before we're just kind of back to our normal lives here at WPI. So we're just asking for a little patience at the very beginning.
Thank you. And I'll ask one more question and then I'll take you off the hot seat. We have had some questions too about how early students could jump into the testing protocol. So if they're local to Worcester, they're willing to jump in their car and come to campus. How early can they start that 2-test protocol?
Saturday, right? There are open hours on Saturday.
Yeah, so the testing center is open on Saturday. I will be honest that I'm thinking off the top of my head, because we hadn't really talked about people taking a PCR test and then going home and doing other, whatever.
Oh, that's
and
true.
then coming back to campus. And so, so we hadn't
for
off-campus
residents, they can start it.
Yeah, right. Yeah. I want to treat everyone the same, but yeah, our idea was that people would move back to campus and then start that testing process. So, so I haven't really thought carefully about residential students who live close enough where they could get tested.
Well, we did answer that question about, can I go home between the tests? And we said, that's not our preference. So for residential students, we really want you to start it the day you move back in. For others, if you're living locally, you can get back in the testing program at any time. And we have a few testing hours on Saturday.
Yep. Yeah.
Or if you're local and you want to get your sort of pre-arrival test, but get it on campus and then go home, that's not one of your 2 clearing tests, but you could do that on Saturday too.
Great, thanks, Lisa. Shifting over to academics, this would be a question for John or Rita. Can you talk a little bit about how faculty are preparing to support students as we start the term, realizing that students will be both in class, potentially remote, transitioning from being remote to in person? What are some of the steps our faculty are taking to support students?
Sure. So the going to the lecture capture by default, as we did in the fall, that got the number of courses lecture captured up to 90%. We'll be continuing that policy. So we anticipate that the vast majority of classes will be lecture captured. It's not mandated because some faculty conduct discussions in their classroom that are sensitive, and they feel that students wouldn't be comfortable if the class is being recorded. Some faculty also conduct discussion-based classes over Zoom already, and lecture capture and Zoom don't play well together. And we've given faculty the option, since they know their courses best and they know their students best, to make the decision that's right for them in their class. Unlike last year when we had all summer to prepare for this and we were able to put together a list of which courses were hybrid, in-person, online, whatever, we've had to make this pivot quickly, which is why we've asked faculty, as soon as they know what they're doing, to put the information in their syllabus and on their Canvas site. So if you don't see that, email your faculty right now, because they're not doing what I told them to do, and they never do what I tell them to do anyways. But we do understand that students are making decisions about what to do for coming back to campus. They may be choosing to add or drop courses based on this information. But given the quick nature of this pivot, faculty may still be deciding what to do. We hope they've all made their decisions as soon as possible. And faculty do have experience with assisting students who are not in class in person. We've done that in A and B terms. The difference now is that since we're seeing much higher positivity rates, for some classes, it's going to be more than just a handful of students. It might be 10% or even more of the class that's out at any time. So things like lecture capture, where many students can have access to a recording of what happened in the classroom, I think most faculty will be doing that, and some faculty will be doing more. And courses that have an in-person component like a lab, faculty will be allowing students to make them up later. But some things about what we do are just really need to be experienced in person. And we found from the hybrid experience, it's a lot more work on faculty, and the students really are asking for an in-person experience.
And just as one follow-up question to that, John, when should students expect to hear from faculty in terms of how they're approaching the first couple of weeks of class?
So some faculty will actively email their class, I would say, if it's a small class. But let's see, so classes start less than a week from today. So you should be, that information should be up on Canvas sites and in syllabi right now. So look for it on the course sites, and if you don't see it, contact your faculty.
Great, thank you. Shifting over to student affairs and life outside of the classroom. Philip, could you talk maybe a little bit about what the process would look like for students who might want to onboard or come to campus a week or two after the start of classes, moving into a residence hall, onboarding, what that might look like?
I may jump in and ask Matt Foster to assist a little bit in terms of what the plan is for students moving into residence hall late. And then actually also ask for Lisa's assistance, because we actually I haven't talked to anyone about this particular piece. So Matt, can you provide any insight into the residential piece in terms of students moving into the residence hall? And then Lisa, any information about what that would do with the onboarding test, Lisa or Chloe?
Yeah, so sorry, Christine, can you clarify what specifically is being asked?
Sure.
that's-
So if a student wanted to move in a week or two after the start of classes, how would
Sure.
they access their keys and stuff?
Yeah. So move-in process is Sunday the 9th through Tuesday the 11th. Actually, what we're going to do is at the end of the day on the 11th, we will look at what keys we have remaining and students that have not yet moved in. And we're going to communicate with all of those students what steps they would take for this first day of classes through whichever date they're planning to return to campus. And so based on what that return would look like, we will communicate specific steps, but it will be during open campus hours when testing is open for students to get tested, and then they would come to our office and pick up their key. And then pending travel, we would make specific accommodations for students. So once they receive that email after Tuesday, very likely Tuesday evening or Wednesday morning, they should respond to that if they have specific needs that we need to meet.
Matt, follow-up, would it be helpful for students if they know that they are planning on arriving late to reach out to you proactively to let you know that?
Yeah, absolutely. That way, then we can make sure that we have that list going. So we're not waiting for that student to maybe arrive, or we're concerned about their travel. So if they know preemptively, please feel free to email res-services@wpi.edu, and we would make a list of that information.
And Lisa, about the 2 onboarding tests. So they would just do them when they get here, and they are going to be under the same constraint. They can't attend in person until they do the two tests with a day in between.
Yeah, and we would also just encourage a pre-arrival test if at all possible as well. So same scenario.
And I think just if I could follow up to for students knowing that we're doing grab and go until the 15th, for students who are dining, who would be commuter students or non-residential students, what does eating on campus look like for them, and what steps are we taking to support those students as well?
Christine, I'll actually be honest, and we're still working on that. Literally, Emily and I were talking about that at the end of the day yesterday. It's like we need to figure out a solution for those students. If there's a space available on campus that is excluded, students can eat there, but it is something that we need to figure out a concrete plan for those students to be able to communicate. I know we did see in the chat also questions about Hampton Inn students, and I know Matt was responding to some of those. And again, that's something we will work out those details, and Matt and residential services team will communicate directly with the Hampton Inn residents once we're able to determine exactly what that plan is. So stay tuned.
All right, I want to be mindful of time because I know we're just at the 7 o'clock hour. So maybe Laurie, I could ask one final question of you kind of as we come to close, is how can students and families best support our efforts as we're starting this new term?
Yeah, so I would say a couple of things. First of all, thanks to everybody for weighing in on things. Look, this is, I'm waiting for, a repeat in this pandemic. It's a little bit different every time we're dealing with a new aspect of it, and this is no different. The big thing that's going to hit us in the coming couple of weeks is a lot of positive cases, whether that's people testing positive who had it over break and didn't really know, and so they're not really symptomatic and such, or people getting infected as they're coming back or immediately after coming back. And so I need the most important thing you can do for us is use the information that's available on the website, and that will be coming in emails if you test positive, rather than picking up the phone and calling someone to try to get a personalized answer to a question, because we just don't have the staff capacity to deal with every single person individually. Take advantage of the shared resources that we have created to help folks through this. So that's actually the biggest thing I could ask, is really think twice before you pick up the phone and try to call, or even frankly send an individual email. We're doing our best to respond, and that WPI is always about a personal touch. This is not something we're comfortable with. This is not our inclination from the beginning. What we want to do is care for each and every student, absolutely individually and personally. What's the next couple of weeks aren't going to allow our normal level of that on this campus. We'll try to get back to it as soon as we can, but it's not going to allow that. So just some grace and some understanding about that, and students, really working together to support each other through this. Those are the things that I think we all need to focus on, is how we can really come together as a community and support each other in, again, yet another unprecedented wave of this, while remembering that this education is important, and we're going to do everything we can to fight for keeping students in class, keeping their educational experience a great one, and moving forward together. So I guess that's what I would say. I don't know if anybody else on the call has other answers, but just know we're doing our very best, and that people are working flat out to try and make all this happen. So we're here for you. We're here with you, and we're going to do all we can to bring us through this together, because we can do this. I really know we can.
Great. Well, thank you so much. I do believe that I know there may be a few questions. We got to a lot of questions, but I think there might be a few that are still in the chat. So for folks who registered with us for the Zoom call, we'll be able to respond to those and get you your answers. But for that, I want to wish everyone a good rest of your evening or afternoon, depending on where you are. And just want to say thank you, and we look forward to seeing you on campus in just a few actually next week.
Yeah. All right. We'll see everybody next week. Thank you all for tuning in.
Thank you, everyone.